He accepted the invite, so I assume he's going to be here. Yeah. All right, and we're live.
I still have a couple minutes to go. Do we wait until exactly 8:30?
We can wait just in case people are signing on right at 8:30.
There's Roger. Good morning.
Good morning.
Morning, Roger.
So many smiling faces.
Okay, and I have 8:30. I will call the meeting of the Public Health and Human Services Board to order. Are there any other adjustments to the agenda? We are going to pull item 3, introduction of new staff. Are there any other adjustments? Seeing none, do we have a motion to approve the agenda?
This is Andrea. I'll motion to approve the agenda.
I'll second.
Motion and a second. We'll do a roll call vote. Oh, I forgot to read the statement, but we will do a roll call vote. Commissioner Swallison.
Aye.
Commissioner Sullivan.
Aye.
Mr. Linehan.
Aye.
Ms. Orist.
Aye.
And Commissioner Hawkins, aye. We have 2 commissioners that are missing this morning. They are in another meeting, and I forgot to read the statement regarding meeting by Zoom, so I will do that now. It has been determined that an in-person meeting is not practical or prudent because of the COVID-19 pandemic and the related peacetime emergency declaration made by Governor Walz in accordance with Minnesota Statutes Chapter 12. We have ensured that all members of the body participating in the meeting, wherever their physical location, can hear one another and can hear all discussion and testimony offered at today's meeting. We have also ensured that members of the public can hear all discussion, testimony, and all votes of the members of the body. We have urged the public not to attend this meeting in person because of the COVID-19 pandemic and have ensured that members of the public can view and monitor the meeting remotely in real time by broadcasting the meeting on the Cook County website. All votes will be conducted by roll call, so each member's vote on each issue will be identified and recorded. So now we will move on to our director's report.
Did we get an approval of the consent agenda, or did I miss that? Oh, and you're on mute.
Yes, I was kind of confused because the approval of the consent agenda included the meeting agenda. So do we need another vote? Do we want to pull? I was confused by the way the agenda was laid out. And we can work on that for next month. Are there any commissioners or members that would like to pull anything from, discuss anything that was on the agenda? No? So do we need another vote to approve the consent agenda? I'm just asking for clarification.
Commissioner Hawkins, I do believe we do need a motion to approve the consent agenda.
Have a motion to approve the consent agenda. Commissioner Sullivan,
So moved.
And I second that.
Commissioner Swallowson. Thank you. So, Commissioner Swallowson,
Aye.
Commissioner Sullivan,
Aye.
Mr. Linehan,
Aye.
Ms. Orist,
Aye.
and Commissioner Hawkins. Aye. Now, we'll turn it over to Allison for the director's report.
You're ready for me. Thank you. And apologies for the confusion with the adjustments to the agenda and how that related to approval of our agenda and consent agenda. So I am going to share my screen. I'm going to try and share my screen so that you can see my presentation. Just bear with me here for a moment. And how does that look? Are you able to see my presentation and not my notes? All right, great.
It's the black screen again, Ellie.
A black screen. Shoot. Okay, let me swap it. Okay.
There you go.
All right.
Got it.
Great. Okay. So first, I'll just start with an apology to our new commissioners to say that last month I came before you and said that it was the 1 month of the year that you have to sit through me talking through both the staff report and the director's report. But here I am again on the agenda for staff report. So I know now better than to make any promises I can't keep about our meeting topics and presentations, but with 3 new commissioners coming on board, with 2 commissioners being away for the meeting this morning, it felt like the opportune time to give an overview of the PHHS department and orientation to the programs that we work with, our staff and service providers. So I'll start with just giving an overview of my overview this morning, the topics that I will be talking about. We'll start with a discussion of how we interact with the state in delivering state supervised county administered programs. I'll give an overview of our advisory councils, a discussion of the mandated human services programs that we work with in PHHS and the essential areas of public health responsibility. Then we'll have a finance overview with Lori giving an overview of the monthly financial reports that come before the board each month for the PHHS department. Then I will give a really high level overview snapshot of the human services cost report, which provides an even fuller picture of human services payments made to county residents and to individuals and providers by the state. So those funds that don't pass through the PHHS department and you don't see on our monthly reports. And finally, how to learn more about PHHS programs and how to connect with staff. All right, so in Minnesota, federal and state statute define what services should be provided. The Minnesota Department of Human Services and Department of Health provide leadership in policy development, implementation and standard setting, training and technical assistance, information systems, program oversight, and performance monitoring and compliance. Program administration and services are delivered directly to people by counties, tribes, healthcare, and other community providers. In PHHS, we work with 2 citizen advisory councils. The advisory councils are established to fulfill the provisions of Minnesota state statute and to make formal recommendations to the PHHS department and PHHS board as it relates to our budget, service delivery, strategic goals, and priorities. The Public Health and Human Services Advisory Council is engaged with all areas of our work as a department, while the local Advisory Council for Children's and Adult Mental Health is focused on mental health services and needs. Both councils provide input about services and coordination of care. They are involved in development of service planning for the county, and they make recommendations regarding services provided and report to the board regarding unmet needs. The council chairs serve as appointed members of our PHHS board, and staff provide administrative support to the councils. The councils are also comprised of provider and community representatives, and currently both councils are recruiting additional members. The PHHS Advisory Council is a key stakeholder in our health assessment and improvement work. The Community Health Assessment and Community Health Improvement Plan, sometimes called a CHIP, is foundational to our work in public health and is a great resource for you all as new commissioners to be familiar with. We are required in local public health to begin a new assessment cycle every 5 years. This process involves bringing together partnering agencies and individuals in the community who are dedicated to understanding and improving health in Cook County. The PHHS department facilitates this process with the vision of fostering continued collaboration and creating a means by which to focus our collective efforts on creating a more vibrant and healthy community. The process included a series of 8 community meetings held between October 2017 and April 2019. During this process, participants reviewed local and regional health data, prioritized areas in need of attention, reviewed the results of a local community survey, and created goals to work towards within priority health areas. The Community Health Improvement Plan takes these goals and links them to specific objectives, strategies, and activities that guide our work as a department. The Public Health and Human Services Department is organized into 3 primary areas: human services, public health, and the administrative, fiscal, and support staff that work across all of these areas. Next, I'll give an overview of services within each major program area. Within adult and home and community-based services, 7 staff provide mandated services in the area of adult services, adult protection investigation, care coordination for older adults in long-term care settings and in the community, developmental disability case management, assessments for public program payment of services for people with disabilities and older adults, and the coordination of the in-home support program. Cook County's in-home support program is licensed by the state, and other than the program coordinator, all service providers are independent contractors and not county employees. In-home support is one of the few non-mandated services we provide as an agency. However, this is an area where the department and the board has made an investment in supporting aging adults to remain in the community by providing transportation, homemaking, and chore services to people who would otherwise require a level of care in a facility or outside of the community. In the area of children and family services, there are 8 staff providing services and coordination of care for local residents in the areas of adult mental health, children's mental health, child welfare, child protection investigation, community support, licensing, substance use disorder case management, parent support outreach program, which provides supports to families to maintain stability and prevent out-of-home placement. Within children and family services, we contract with Greg Barnier for chemical health services, some of which are mandated by state law. Counties are not mandated to provide outpatient treatment services. However, this is another area where the board has invested resources in local treatment services for the benefit of county residents. In the areas of economic assistance and healthcare programs, staff determine eligibility and enroll residents in programs that provide assistance with basic needs and payment of healthcare services. Programs include nutrition assistance, or the SNAP program, short-term cash and childcare assistance programs for families to help them return to work, healthcare programs and payment of long-term care services. And in this area, we contract with Carleton County for child support services. And this is an agreement we've had in place since 2013. As I said, administrative and fiscal staff work across all program areas, providing coordination, customer service, contract and grant management, among other supports. Fiscal staff in particular perform mandated grant reporting duties, receipt of state and federal funds into accounting systems, estate recovery functions, and billing for services provided by staff and licensed programs. And we are planning to provide more information about how our fiscal and program staff work together to earn revenue that helps fund staff salaries and the services that they provide in a future presentation. Within public health, staff provide coordination and leadership across all 6 essential areas of public health responsibility. Those areas are assuring an adequate local public health infrastructure, promoting healthy communities and healthy behaviors, preventing the spread of communicable disease, protecting against environmental health hazards, and preparing and responding to emergencies. Sawtooth Mountain Clinic and North Shore Health are contracted to provide a number of public health services, including family home visiting and home care nursing. Environmental health staff within the county and the state health department are responsible for investigating public health nuisances and food pool lodging, licensing, compliance, and enforcement. In recent years in Cook County, the roles of public health staff have shifted from direct nursing services to more population health work. This is consistent with a statewide goal of developing a more modern public health system, sometimes called Public Health 3.0. In the vision of Public Health 3.0, local health departments fill the role of a chief health strategist, driving initiatives that improve community health by partnering across multiple sectors, including intragovernmental, healthcare, and businesses, and leveraging data and resources to address social, environmental, and economic conditions that impact health and health equity. So this is evidenced in our community health assessment and improvement plan. As new commissioners, as your members of the public and your constituents have questions or concerns, there's no need to memorize what person matches what alphabet soup acronym. We've put some procedures into place within the department to improve access to staff and our internal procedures as well for connecting with services and supports. So an example of this is our intake procedures, both within the areas of economic assistance and healthcare programs and in social services. Each day during business hours, there's an assigned person to intake who is available to address any questions. They're monitoring this email address, for example, and taking phone calls that come in through the front desk. Other ways to get in contact with PHHS staff, we have a general information email address, and then the COVID-19 hotline and email address as well. Also, it's important to know that many of the programs that we work with have formal appeals processes, and staff are trained on how to follow program requirements as it relates to grievances or concerns. And a lot of this information is sent out in official correspondence from our department as well. So I'm going to take a pause if anyone has questions before I hand it over to Lori to begin the fiscal overview.
Does anybody have questions for Allison? Go ahead.
Allison, I have just a request. I'm wondering if we could get a copy of your slides. I find that the flow charts that you have and all are very, very helpful. And so if that could be shared with the commissioners, I think we would appreciate that.
Absolutely.
Thank you.
Yeah, and I think the list that you gave me of all the acronyms, that should go out to all of us. So it really was helpful to have that list so you can look at it and know what all those acronyms were.
Absolutely. I'll include that. Great. Well, I'll hand it over to Lori, and if there are any other questions, we'll have time at the end as well.
Good morning, everyone. As part of the agenda, you would have received the monthly financial report. And so this is what the first page of the monthly financial report looks like. Every month, I provide this financial report summary to the board. It is produced after the auditor's office has confirmed that my cash balance numbers match what is indicated down at the auditor's office. On our monthly financial report for January, that's attached to the agenda. I'm going to use that as an example as I'm going through just a little training 101 here. The first page that you see here is a summary of our 3 department areas with several subheadings under each area. This report shows the year-to-date expenditure and collections as compared to the annual budget. The expenditures columns show the budgeted expenses for the services in 2021 and the year-to-date payments that have been made. The collections columns show the budgeted revenue for 2021 and the year-to-date funds that have been received. Now, logic would tell you that since there are 12 months in a year, that by the end of January, we should be 1/12 of the way through our expenses paid and our revenue received. However, invoices are received about a month or 2 after services occur, and most of our revenue is received after quarterly reports are filed. So our costs will be quite low for the first couple months of the year. State and federal revenue for the first 3 months will not be seen in our agency until after those first quarter reports are filed in April, and then we'll begin receiving those reimbursements in May or June. So as you're looking at this, that's why you see for a total so far this year, we've only expended 3% of the budget and we've collected only 1% of the anticipated revenue. And go ahead. So the first section of that summary report is shown for income maintenance. That's also called the economic assistance area. The subheadings within this area you'll see are staff and administrative, direct services, and child support. Each department area also receives funding from the county tax levy, and it may have an approved use of fund balance. This summary report shows the budgets for each of the subheadings compared to the expenses paid and the revenue received so far for the year. And there's similar subheadings listed under each of the areas for social services and also for public health. Go to the next one. As Allison mentioned earlier, our agency does have 3 distinct program areas: the economic assistance or income maintenance, the social services area, and public health. We also have administrative costs that are shared between the 3 areas. And these examples are the director and fiscal and support staff wages, phones, county and state IT costs, the state auditor fees, the rent that we pay. These costs are split proportionally among those 3 program areas in the form of an administrative allocation. And the split is based on the number of full-time equivalent staff within each of those areas. We also assign a small portion of those administrative costs to the SUD program so that we can acknowledge what the true cost of operating that program is. So to help the new commissioners translate the summary financial report, the line item detail for each of the program areas subheadings is included after the summary page. So when you're looking at the the attachment that's on the January agenda, you'll see the summary page is the first page. On pages 2 through 10, you'll see what's included within each of those subheadings. For example, within the income maintenance expenditures, one of the subheadings is for staff and administrative. When you look below that, you can see the detailed line items include the salaries, the travel costs for staff, supplies, the software license and support fees. And then I've also got placeholders there for previously known expenses. And this one, you'll see that there's SNAP enhanced expense and CARES expense. These things are not budgeted items, but they've been known in previous years that we were going to receive funding for those. So I plug in a line item there under the revenue, and then also one under the expenses for the associated costs that'll pay for those. There are similar line item details for each subheading within each of the 3 program areas. These are all rolled up into the very much easier to read summary page that you'll receive every month. Our agency will be paying some of the remaining 2020 invoices through the end of this month, and we'll also continue to receive some of the 2020 revenue through the end of March, and that would have been for the 4th quarter reports that we filed with state and feds, and that money will be coming in through the end of March. These accruals will be included into the year-end 2020 financial report, and I'm scheduled to give that report to the board, I believe, in May. Any questions on the financial side before we turn it back over to Allison?
I just have a question about what does merit mean? What is merit? That was on one of your pages there.
That is under the administrative allocation, we are as an agency part of the merit system through the state of Minnesota, and Allison can give a little more detail what the merit system does for us.
Yes, so the Department of Human Services merit system is part of the Department of Human Services, and they provide oversight and assistance as it relates to some of our human resources requirements. So they provide support with position description design. We're required to have job descriptions that fit within the Minnesota merit system requirements so that there are consistencies between county agencies that are delivering the same human services within the state of Minnesota. The merit system also requires us to follow civil rights and equal employment opportunity requirements because of the federal funds that we work with as an agency. And this is an area where I am working really closely with our representatives at the Department of Human Services Merit System and PAM to ensure that we are all within requirements for county, HR and personnel policies, as well as the Minnesota merit system. And this is an area where, as a small county, we get a lot of support from the merit system, where otherwise it would be difficult to meet all of those requirements with our own human services or human resources department. And we do pay a fee for participating in that, and that's why you see it in the budget.
Anybody else have questions?
So the information that Lori presented on our budget and the monthly financial reports represents just a portion of the fiscal impact of our work in PHHS. The Department of Human Services cost report provides the big picture of costs and revenue sources involved in providing human services programs that are administered at the county level. This report includes centralized payments that do not flow through the PHHS department, but directly from the State Department of Human Services to individuals and providers. This snapshot of human services costs for Cook County is from 2018, and that's the last year that the data is available from the Department of Human Services. There's a several year delay in having all of the reporting information complete. And this is not an area that we've really presented to the board on. So this is new information for many of our commissioners, and an area that I'm interested in bringing more information to the board at future meetings. So you can see here in this snapshot from 2018, the total cost of human services in Cook County was $15.5 million. Of that total cost, 13 million or 81% was Department of Human Services centralized payments made directly to individuals or providers. The total cost of services, of the total cost of services, 4 million of that was for social services, and that includes children's services and services to people with developmental disabilities. Of that total, 1 million was support payments. So this is what you would know as the nutrition assistance or SNAP program and cash assistance made directly to individuals and families. And again, of that total, the vast majority is healthcare. So 10 million of that 15 million was medical assistance payments for medical and dental care, cost for people requiring facility level of care in a long-term care setting. In the Human Services Cost Report, we can also look at trends. So notably, you can see here a dramatic increase in healthcare costs. The total cost has doubled since 2012. This is due in large part to Medicaid expansion in Minnesota. And this increase does follow statewide trends. Our department did add staff in 2016 and 2017 to respond to the increase in caseloads. However, personnel is just a fraction of the overall costs. This more likely represents a change in access, eligibility, and healthcare needs in the community. This next slide is a snapshot of the revenue share for Cook County Human Services programs. So of that 15.5 million of human services costs in 2018, 87% or 14 million approximately came from federal and state sources, with 9% or 1 million from county revenue. We can see a breakdown of revenue sources by program category. Support and health programs have the largest share of state and federal revenue, and social services has the highest reliance on county revenue. We can also look at trends in the state and federal revenue. We can see that those have both trended upwards in recent years, corresponding with the increased cost. However, county revenue has remained relatively flat, as you can see the yellow line over that same time period. And again, I hope to bring a deeper look at county cost reports at future meetings, either a more in-depth look at the report, looking at trends, comparisons to other counties. We can see things like per capita costs. Otherwise, I thought we could also share information from the Human Services Cost Report that would correspond with future staff presentations. So for example, if we have a staff presentation on child welfare services, we might look more deeper at trends in child welfare costs. So something that was impressed on me early on in my work in human services is that the only thing constant is change. While change happens very slowly in government work, state and federal policy changes can have a very significant impact on our work. As you could see in those last slides on the Human Services Cost Report with how expanded Medicaid has impacted our staffing levels as a county. Another example of that is significant changes in the child welfare system in Minnesota in the last 10 years or so. That changed screening requirements for staff that are performing child protection investigation, and there was some funds associated with those changes that allowed us to expand our capacity within the department as well. Another significant change in recent years was the Min Choices assessment system, which is the process by which older adults and persons with disabilities are assessed for eligibility for payment of long-term care services. Some significant changes that are currently underway include the many program waivers and modifications that were put in place due to the public health emergency that allowed us to continue to serve residents by using phone and video technology. Substance use disorder reform is another significant change underway in the state of Minnesota that impacts how chemical health services are provided. One result of that is the newly available service of treatment coordination or care coordination, and we have hired a staff person to be able to provide that service in Cook County as a result of those reforms, and in response to our health improvement plan, which identified supports for people in recovery as a priority health issue. Another significant change underway at the federal level is the Families First Prevention Services Act, which will fundamentally change how services to children are funded, shifting a lot of resources from facility level of care for children in need of out-of-home placement towards increased investment in certain evidence-based treatment services. Another change underway at the state level and regional level is with our adult mental health grants and looking at changing the formulas for how counties receive funds to administer mental health services. So to learn more, each month at our Public Health and Human Services Board, we have typically a staff presenting on a certain program area, changes, services. We also have, to correspond with that, a monthly newspaper column in the Cook County News Herald and interviews on WTIP. Again, those typically correspond with the staff presentations here at the PHHS board. We've also increased our outreach on social media in recent years, sharing relevant, high quality information, original content on several different platforms. And we've really increased our reach during the pandemic and have seen a lot of people coming to our Facebook and other sites to get current information. Specific to COVID-19 response, there's a number of ways to get updates, including weekly interviews on WTIP with Grace and other healthcare and public health leaders. Public health and emergency management provide regular updates at the county board meeting as well, as many of you know. And then the COVID-19 hub site continues to be our central point for current information on our response efforts, including information on the vaccine rollout in Cook County. So that is all I have for my overview this morning. I know it's a lot of information. Like I said, I'm happy to share the slides and happy to address any questions you have. I see that a number of our unit supervisors are on the meeting as well. If there are any specifics that I'm not able to address, they're here to have my back. So happy to take any additional questions.
No questions, but Allison and Lori, thank you very much. That was actually very informative and helps bring me up to speed so that I can engage with, at a better level as we go forward. Thank you.
I'd like to thank all of you for your excellent work and looking at those last slides on COVID. Just thank you for all you've done for our community.
I have a question about Community Health Fund. Can you tell me what that is?
Are you referring to the Public Health Fund?
Yeah, it said Community Health Fund, and I didn't understand what that was.
Yeah, so I can give some background on that, and Grace and Lori are also deeply involved in that as well and can help speak to that. But within the last 4 years, I believe it was in 2017 or 2018, the board delegated authority for grant management of some of the non-discretionary, non-mandated funds to the Public Health and Human Services Board and our advisory council. So members of our advisory council serve on a task force that reviews those requests for funding each year for those organizations that serve a public health purpose in the community. So at the Committee of the Whole meeting a few months ago, you heard an update from Beth Green with the Senior Center. That's one of the primary recipients of grant funding through this process. Other organizations historically have included some childcare facilities, violence prevention center, legal aid, organizations like that that are working within our mission care partners that serve a similar public health purpose. So again, I believe it was 17 or 18, that became a competitive grant process where grants are submitted to the PHHS department, and we provide administrative support with that process. But those recommendations are made by our advisory council members, and we've really worked to have that process, those funding recommendations, align with our community health improvement plan. So how are these services, how is this program reaching our broader goals for community health improvement, and how is this request aligned with those goals?
I'm also wondering about caseloads and recommended caseloads for the different areas. Can you speak to that?
Sure. Well, program areas, caseload recommendations varies by program areas. And in some cases we are within, in some cases we exceed recommended program caseloads. And in some areas there is no guidance from the state, and it's really a county decision best practice for managing caseloads. So I can go into some detail by program area what that looks like, unless there's a specific area that you're interested in, Commissioner Hawkins.
No, I'm just looking overall, just trying to understand things.
Sure. So I'll start with the economic assistance and healthcare programs, because that's my background and what I'm more familiar with. In that area, we have a case bank system. So staff work within a case bank, and it's a shared caseload system. So we might have 2 staff working in long-term care services, and then other staff work across all program areas. And that's been a way to really improve quality and customer service, in that when one individual, historically, a person might be working on a one-on-one basis with a caseworker, and if that person was on vacation, that individual might have to wait a long time to hear back if they have questions about their services. With a case bank system, that burden is shared across a number of staff, and there are many benefits with that. Beyond customer service, there's a quality assurance as well. With multiple eyes on a case, staff are able to have some internal controls as well. Within social services, other than intake, more often an individual is working on a one-on-one basis with someone receiving services, or a family. And Grace, I don't know if you want to speak a bit to some of the caseload requirements within children and family services, and where we are with staff caseloads there.
Sure. Thank you. And thanks for that question. That's a really good one. And one that we think about too a lot. The area that has specific requirements for caseload limits is in the area of mental health. And in children's mental health, the caseload limit is 16 work groups. And a work group is defined by how we enter it in our electronic record system, SSIS, and that's how we determine that. And a work group can include many, many people, because it's just the primary individual you're working with, plus their parents, and sometimes there's many parents involved, siblings, because the whole family is affected. But the rule for children's is 16 for children's mental health and 32 for adult mental health. And in both of those areas, we exceed the number of work groups. I keep an eye on that along with the case manager to make sure that some of the work groups are closing as some are opening. So we try to stay in balance that way. In the area of maltreatment. There are not state required limits, but there are limits for personal capacity to be involved in really complex situations that also have court involvement. We found that the better quality and greater safety is assured with smaller workloads, which means there's an overall reduction in out-of-home placements as well, which is best for the children and the family and for the budget. So there's no specific guidelines in that area. And those are the primary areas that I would say I can speak to.
I would also just add that in the year-end report that I gave last month, there were some caseload information by program area as well. And it is and it isn't a valuable way of looking at our work. It's really challenging because we work in many different systems, and this is all as required by the state. Early on in the presentation, I shared that the state has central authority of the information systems that we work with. So just in one, one family might be interacting with our staff in many different program areas. They might be receiving nutrition assistance and cash assistance and healthcare. Maybe they're receiving children's mental health and parent support outreach. Maybe that parent is also receiving some chemical health services as well. That's 6 different computer systems and program areas that our staff and that family is interacting with. And this is something that the state and that certainly counties feel is a need for more simplification and to make the programs more user-friendly and streamlined. And that's an active and ongoing process to improve how human services are delivered. But when asked for caseload information, it's hard to provide because someone might be interacting with our department across multiple systems and multiple program areas, each with their own data reporting.
Are there any other questions? Can't see everybody. Well, thank you, Allison.
Yeah, thank you.
And Laurie, and Grace, thank you. I'm sorry, gotta get back to. See, anything else, Allison?
Yes, I do have a few other updates, including an overview of one of the items for board action. An update from our staff and exciting initiative underway in the area of improving how people access services through PHHS is that Cook County was selected as one of 10 counties in a cohort within the state of Minnesota to offer a new way for residents to apply for economic assistance programs. In partnership with DHS and Code for America, which is a national nonprofit organization that works with governments to strengthen public services through more user-centered technology. So what this means for Cook County is that there will be a new online platform available through minnesotabenefits.org. And this will be available alongside the current online application platform, which is ApplyMN. Residents will be able to use either application form during this time period, and the goal is eventually for Minnesota Benefits to replace ApplyMN. This system is currently available in Hennepin, Olmsted, Wabasha, and Wright counties. And again, Cook County is a part of a cohort of 10 other counties that will be introducing it this spring. Some of the benefits of this new system is decreased application time, It's a mobile device friendly application platform, and there are no login and account requirements. Within the department, we will be conducting staff training in February and estimated go live in March of making this program available locally. And perhaps we can bring a demo of the program to a future PHHS Advisory Council or board meeting. Also within the area of economic assistance programs, staff are reviewing our emergency assistance policies and looking at ways to expand eligibility and access to that program and to be more consistent with some of our regional peers. So that policy revision will go before our Public Health and Human Services Advisory Council in March as well. We are in talks with a student, Master of Social Work student locally who is looking for an internship placement, and are talking about how she might support some ongoing needs assessment work in the area of transportation. Again, this is one of our community health improvement goals, a strategic goal of the North Shore Healthcare Foundation, and we have a potential partnership with the Healthcare Foundation to work with this student intern. So I'll be sharing more information about that opportunity as well. Another significant opportunity underway that was a part of your agenda this morning is the Rural Communities Opioid Response Grant. Included in items for board action is a request for support for this grant application. Just a little background on the grant and where we are with planning for this. Kate Serbat, the clinic, reached out a couple of weeks ago regarding this grant opportunity. It's through HRSA, which is a federal agency affiliated with the Federal Department of Health and Human Services. They are accepting applications for fiscal year 2021 for this Rural Communities Opioid Response Program. This would be a multi-year initiative aimed at reducing the morbidity and mortality of substance use disorder, including opioid use disorder. So it would not be specific to opioid use. There would be some flexibility, especially as it relates to prevention activities in some of the grant areas. So again, this funding opportunity would aim at strengthening and expanding prevention, treatment, and recovery services to enhance rural residents' ability to access treatment and move towards recovery. Again, another area of priority in our community health assessment and improvement plan. Kate was made aware of this opportunity through a contact at the University of Minnesota Duluth School of Pharmacy, who is leading a very similar grant initiative right now with Boys Fort. This is a 3-year project and up to $1 million grant award. The University of Minnesota Duluth would be the primary grant applicant and would take responsibility for grant writing and some of the administrative functions as well. Grand Portage would be a primary partner, as well as the Sawtooth Mountain Clinic and Cook County PHHS. So we have had some initial meetings with leaders in Grand Portage Health Services and Human Services, and with Kate at the clinic to talk through developing a work plan, how this opportunity would strengthen existing programs and services throughout Cook County and Grand Portage, and how we might use this opportunity to expand as well through each of our respective organizations. We're meeting later this morning to further discuss and develop that work plan. So again, the item for board action is a letter of support for the University of Minnesota in making this application.
So it said on here it was a resolution of support, but you're just saying it's a letter. We are saying we support UMD in applying for this grant.
Correct.
Or I kind of thought a resolution was going to be included in our board packet. Do you have a letter or a statement written out to read to us?
I do. So the letter of support went out in an update yesterday from iCompass, and then in the updated invite this morning, but I'm happy to read through that.
Thank you.
And I can share my screen as well. If you'll bear with me, I'll pull it up so everyone can see it while I read it. Are you able to see it?
That's better.
Okay, so the resolution of support is whereas the Cook County Public Health and Human Services Board is authorized to undertake activities to promote the health and well-being of the community and to enter into agreements with public and private entities. And whereas the Health Resources and Services Administration provides opportunity for the University of Minnesota College of Pharmacy Duluth campus in collaboration with the Grand Portage Band of Lake Superior, Chippewa, Sawtooth Mountain Clinic, and Cook County Public Health and Human Services to submit a competitive grant application, Rural Communities Opioid Response Program Implementation, for the purposes of substance use prevention, intervention, and recovery. And whereas the Cook County Public Health and Human Services Board finds that support of this grant application may provide benefit to the health and well-being of Cook County, and now therefore it be resolved that the Public Health and Human Services Board hereby approves investigators at the University of Minnesota College of Pharmacy Duluth campus in collaboration with Grand Portage Health Services, Grand Portage Human Services, Sawtooth Mountain Clinic, and Cook County Public Health and Human Services to submit a grant application for the purposes of seeking funds for substance use prevention, intervention, and recovery. And I should also say that a similar proposal will be going before the Grand Portage Reservation Tribal Council as well.
Thank you, Allison, for reading that. Do we have a motion to approve this resolution?
I'll move it.
We have a motion and a second
I
by
second.
Commissioner Sullivan. Sorry, I saw your hand raised first.
That's fine.
So we have a motion and a second. I will do the roll call. Mr. Linehan,
Aye.
Commissioner Sullivan,
Aye.
Ms. Orist,
I have to abstain since I'm an employee at Sawtooth Mountain Clinic.
Commissioner Swallowson,
Aye.
and Commissioner Hawkins, aye. It is passed. Do you have anything, other actions or information, Allison?
Just one last quick update. First, thank you for your support for the grant application. Just want to say briefly, the legislative session is underway. As always, this is something we're watching closely within PHHS as it relates to the services and programs we administer. I want to just let you know that the AMC is publishing weekly legislative updates, and this is a great source of information as it relates to public health and human services and the many other areas that your work intersects with us as county commissioners. One area that both the Association of Minnesota Counties and the statewide associations that I participate in for local public health and human services administration is continuing to support flexible funding for a statewide response to the pandemic, including vaccine distribution, outreach, and education, and continuing some of the health and human services waivers that were put into place during the public health emergency, and looking at continuing those on a long-term basis as a way to improve service delivery to residents and community members. Recently, the Department of Human Services released the statewide telemedicine utilization report that was included, I believe, in the most recent AMC weekly newsletter. But if not, I can include it in my email out to the commissioners along with the presentation materials, as it's a nice summary of telemedicine and telehealth in the state of Minnesota. and certainly important to our service delivery in a rural remote community. That's all I have for updates.
All right, thank you. We'll move into our committee reports. Since we don't have Commissioners Storley and Mills, I guess Arrowhead Regional Corrections, I have a meeting on Friday. I did tour Arrowhead Juvenile Center. It was very interesting and informative. And another area where this working by Zoom, or the court meetings that can be handled by remotely now, has been very beneficial, and kind of like telehealth. We hope some of those things can continue into our future. Let's see. Looks like, Roger, do you have anything to report?
We have not met this month. We'll be meeting again in March. Our subcommittee looking at recruitment and other issues about the council will be meeting this afternoon, and hopefully have something for the PHHS Advisory Council for its March meeting, and hopefully for this council, or for this board in its March meeting as well. That's all.
All right, thank you. And Andrea?
Yes, thank you. So the Mental Health Advisory Council met on February 9th. The bulk of our meeting was a discussion that we held in conjunction with a local teacher. Sorry, my notes are on 2 pages. Regarding her perspective on promoting positive mental health and well-being in the schools during and pre-pandemic. We discussed some communication ideas that could assist in supporting families, specifically in regards to the programs that Public Health and Human Services offers. And the whole group was in consensus that the schools have done an amazing job throughout this experience, even through the learning curve that the school staff themselves had to work through to create a safe atmosphere for the students and families. We also received information regarding the support and appreciation effort that North Shore Healthcare Foundation has begun to, in order to thank local healthcare workers for their work through the pandemic. We received information from the Restorative Justice Program on a training program they're offering in March to help support and incorporate tribal traditions into the restorative justice practice. And then we also had a discussion regarding the community trauma experience during the pandemic and how we can build support structures to assist community members through the community support line and other local programs.
Thank you.
Yeah.
Commissioner Sullivan, do you have anything to report?
Yes, last week we had the Emergency Preparedness Committee meet, and as expected, the primary topic was COVID. And just a lot of kudos to all of the people who have assisted with putting together the hub site. It continues to be a central trusted resource for our community. And Rena Rogers talked about that site hitting an average of 806 times a day. So people are really going there for up-to-date information. And right now, about 38% of our population has had their first vaccination, and that includes, of course, essential workers and people in our healthcare system, and that 65 and older population. And currently, Forest Service staff are also essential workers, and they're in the process of getting their first vaccines. And this Thursday, there will be 100 more vaccinations available to our community. We did discuss some of the questions or confusion around who gets the vaccine, and Jen Sorensen talked a little bit about Grand Portage because, of course, being a sovereign nation, they determine how they're going to distribute their vaccines in a different way. And they did allocate vaccines to not only the band members, but to all employees and to the employees' immediate family members. And the good news is, although there was a little confusion, that any excess doses that they have can be reallocated or distributed here in Cook County. So that is a real benefit to all of us. And we appreciate the cooperation between Grand Portage and the greater community.
Thank you. Commissioner Swallison, welcome to your first meeting. Do you have any comments that you would like to make?
No, just that this has been very informational to me, and I'll certainly work to contribute more as we move forward. Thank you.
I would like to also encourage the commissioners, the new ones. I have found that the AMC website, there's webinars. You know, I've watched a few of those now. It's a lot to take in, and this is going to be a big learning curve for me, understanding all this, but I did find some of those helpful over the weekend. So does anybody else have anything they would like to add? If not, I will entertain a motion to adjourn.
This is Andrea. I'll motion.
Do we have a second?
I will second.
All right, we'll do a roll call vote. Andrea?
Aye.
Commissioner Swallison?
Aye.
Commissioner Sullivan?
Aye.
Mr. Linehan?
Aye.
And Commissioner Hawkins is aye also. We are adjourned. Thank you all.
Thank you.
Thank you.